From Bath in the United Kingdom by Dr. Bharat Pankhania, who's a senior clinical lecturer at the University of Exeter Medical School. Dr. Pankhania, thank you so much for joining us here today on The Edge from my favourite city in the United Kingdom.
Thank you.
Today was going to be a big day for the UK. The 21st of June was going to be the lifting of restrictions, and now we're hearing the 19th of July. Now, obviously, dates are important for people because they want to have something to look forward to. But what is the reality?
So the reality is, unfortunately, the Delta variant was allowed to seed the United Kingdom population. Having started its seeding process with lots of people returning from India, the train was set into motion. And as this variant, Delta variant, is much more infectious, we've got a rising number of cases, and the rising number of cases in the unimmunized group. So what we have to do is use the break, i.e. the delay in removing the restrictions, to do our homework. And the homework that we must do is immunize, and immunize as many people as possible in the other age groups that have not been immunized. That will buy us a bigger safety net. And that is what we're going to hope. And finally, what we hope is that with a large population immunized, we will be able to have the disconnection between rising number of cases not mirroring a rising number of hospitalizations. And when we reach that safety line, it would be much easier to say we lift restrictions.
Now, here in Turkey, as in the UK, the number of people being vaccinated is going up. I'm very grateful I got my second dose of vaccine last week, and the procedure continues on. Now, have we yet seen or what are the effects that we've seen from large numbers of population being vaccinated, using the UK as an example? Or what are the effects of the vaccination campaigns?
The vaccines are working very well. It is stopping people from entering ICU, intensive care units. That is what we want. And by and large, it is protective, and it is protective against all the variants that we've now come across. So it's very good, it's very effective, and I feel that for planet Earth, vaccines are the only way out. But the trouble is, if we don't hurry up and immunize other parts of the world, any day, any time, we could get a variant which bypasses the vaccines, and that would put us back to square one, unfortunately.
And this is a very important point, isn't it? We know that there's the COVAX scheme. Last week, the G7 made the big announcement of 1 billion doses, which sounds like a very large number. You say, Africa is in dire situation with vaccinations. So, again, the same question, what is the reality there?
So the reality is dire in Africa. We have no capacity or minimal capacity in intensive care units, very poor supply of vaccines and poor uptake of the vaccines, and shortage of fundamentals like oxygen. So whilst the media is not there, the situation in Africa is pretty dire. And for the G7 countries, the world's richest nations, to offer 1 billion vaccines sometime in the future is not good enough. They need to offer many more doses, and as fast as possible. It is in the interest of their own in case variants arise, and it's also a humanitarian thing to do, which is not only immunize your country, but allow other countries to also have a level of protection via the vaccines.
And so this protection of, if not your neighbour, but the person down the street, is actually protection of yourself, because they're not going to come and bring something, some new mutation. So, absolutely,
and we really need to learn that the world is one family and act as such.
And so, what does is the problem caused by the fact that not enough vaccines are being produced, or that some countries are still holding on to doses that they have no intention of using, or they're trying to get the 100% vaccination of their own population before sharing a bit with somebody else. Well, what's the main sticking point, do you think?
All of them are sticking points. So there is a shortage of vaccines. We know that. And then there is the big players with the money, the deep pockets. So they've put in advance orders and purchased billions of doses, and they hold on to them and they say, we're going to immunize our population. It takes a very brave and good politician to say, we're going to immunize us, and we're also going to enable others to be immunized simultaneously. Norway was a great example of saying, we're going to immunize the rest of the world as well, rather than just immunize ourselves. So we need to do that. And then there is this thing of the patents. So the vaccine manufacturers have the monopoly on making the vaccines. And I say this, going forward, 6 months, 12 months, 18 months from today, we will need the vaccines. And therefore, the sooner the patents are relaxed and enable other people under license, under supervision, under scrutiny to also manufacture vaccines, it won't improve things. So we need to enable other people, other countries to also manufacture the vaccines.
What about moving on from vaccinations? Let's talk about some other behaviours. Summer is coming, so everybody wants to get outside and they want to get some fresh air. Many want to travel. What about general things? Firstly, is travel a bad idea? And alongside that, people that have been immunised, should they be still wearing masks?
Yes, good question. So with respect to people who have been fully immunized, we know that they are less infectious. The issue is we have a large number of people still to be immunized. So it becomes very difficult to say we've now got a cohort of people who are now exempt from wearing masks. But that good time will come very soon when we will be able to say viral activity is low, case numbers are low, you may not wear your masks, especially in sensitive areas, because you're unlikely to be infected and infectious. That time will come. At the moment, it's very difficult to say you have been immunized, therefore you don't need to wear a mask. With respect to travel, the issues are, upon your return, you may introduce a variant that causes a lot of harm in your country. The other issue is when you go abroad, you may also take variants from the UK to other distant parts of the world where they are not able to manage a rapidly spreading, highly infectious variant. So those are all the issues. And of course, another one is you may overwhelm somebody else's healthcare system. So at the moment, travel, for the reasons I have stated, is a little bit tricky, especially into poorer countries. Mm-hmm.
So again, it's thinking about the other before yourself, and maybe just being a little bit patient is the sensible way forward.
Yes.
What about some good news? I understand that some new treatments are being discovered on some monoclonal, if that's the right word, treatments are being discovered to help people recover from coronavirus. So we're still learning about many things. So what's the good news on the treatment front?
Oh, there's several lines of good news. One is, of course, the vaccines. The other is there is work going on antiviral blockers. That will come along, and there's a lot of work going on. And then with respect to the monoclonal antibodies, that's also very good news, which is we can manufacture antibodies, very specific antibodies, in the laboratory. And if we catch somebody who is a case and ill early enough, and then the early administration of these laboratory-made antibodies is proving effective. But the thing with monoclonal antibodies or any antibodies is the sooner it is given, the better. So the trick there is to always watch to always catch the case as fast as possible and then give them the monoclonal antibodies, but it has to be given as early as possible.
So there again, it's all about giving great respect to all the medics that are researching into this. Just as a final summary, but about a minute left, half a minute left. What are the key things that we should be doing?
So we need to immunize. We need to immunize the rest of the world. In the meantime, don't drop your guard. Wear a better quality mask to prevent yourself from getting infected, especially if you have not been immunized as yet. Good times will come, and I must emphasize, good times will come.
And we can enjoy the party maybe next year. Dr. Bharat Pankhania, thank you so much for joining me today. It's been fascinating speaking with you. Thank you very much.